Imagine there's this global alarm system, one that's constantly silently scanning for major health threats. We're talking heart disease, diabetes, cancer, long before they turn into full-blown crisis. Well, that system is real. It's called public health surveillance. And today, we're going to figure out how we actually know if it's working. Okay, let's get into it.
So here's our roadmap. We'll kick things off by getting a handle on a huge global health problem. Then we'll look at the tools we use to track it. From there, we'll explore how you even grade a system like this, apply it to a real-world case study in Malaysia, see how they did, and finally, take a look at what's next for the future of health tracking.
All right, first up, let's talk about what I like to call the world's silent pandemic, non-communicable diseases, or NCDs for short. Now, these aren't the things that grab headlines every single day, but trust me, their impact is absolutely staggering.
To really put this into perspective, just look at this number. By 2014, in a country like Malaysia, NCDs were responsible for over 70% of the entire burden of disease. That's a massive slice of the pie, all driven by conditions that often take a whole lifetime to develop.
So what exactly are we talking about when we say NCDs? Well, these are the big ones you've definitely heard of. Cardiovascular diseases like heart attacks and strokes, most cancers, diabetes, and chronic lung conditions. These are, hands down, the leading causes of death and disability across the globe.
So, how in the world do you keep an eye on these giant, slow-moving threats? Well, that brings us right to the heart of our topic today, public health surveillance.
Okay, I know, that's the official, kind of wordy definition. But what it's really saying is that surveillance isn't just about grabbing data. It's a whole cycle. You have to collect it, analyze it, figure out what it means, and then, and this is the most important part, share it so that public health officials can actually do something about it. Action, that's the whole point.
A much simpler way to think about it, a surveillance system is basically the smoke detector for public health. Its job is to start beeping really loudly, really early, giving us a chance to react before a tiny bit of smoke turns into a raging fire. It's our early warning system.
But here's the thing about smoke detectors, right? They're totally useless if the battery's dead. So how do we check the batteries on these huge, complicated surveillance systems? How do we grade them to make sure they're actually working?
Luckily, we're not just guessing here. There's a standardized playbook for this. The US CDC developed a really detailed framework specifically for this purpose, to evaluate public health surveillance systems and make sure they're ready for the job.
And this framework, it's not just a simple checklist. It's a really rigorous process. It all starts with getting the right people in the room, because you can't evaluate something this complex in a vacuum. Then you have to deeply understand the system, gather solid evidence, draw conclusions that actually make sense, and finally, and this is so crucial, share what you learn so the system can actually get better. Okay, enough with the theory. Let's see how this whole thing works in the real world. We're going to take this framework and apply it to our case study, Malaysia's surveillance system for NCDs. At a high level, Malaysia's system has three main pillars. First, it tracks the outcomes, things like death rates and cancer cases. Second, it monitors the risk factors, like smoking or diet, through a huge national survey. And third, it tries to measure how the health system itself is responding through things like vaccination programs.
Let's dive a little deeper on the outcomes. They use national data to track who's dying and a national registry for cancer. But what's really interesting here is their use of something called a verbal autopsy. It's basically a structured interview with family members to figure out a probable cause of death. It's a super clever way to get vital information when a doctor wasn't around to certify it.
Now for the risk factors. The main tool here is the National Health and Morbidity Survey. This thing is a massive undertaking. It happens every 4 years, and it's based on a standardized World Health Organization method called STEPS. It gives them this incredibly detailed snapshot of behaviors and health metrics across the entire country.
So, with all of that in place, how does Malaysia's system actually stack up? It's time to look at the report card. The good, the bad, the strengths, and the weaknesses.
So on the one hand, the system has some real strength. Its tracking for outcomes and risk factors is pretty solid. It uses internationally recognized methods, which is great, and it has those clever solutions like the verbal autopsy. But on the other hand, there are some pretty big cracks in the foundation. The biggest one, it really struggles to track how the health system itself is performing. Plus, the split between public and private healthcare creates these information silos, and there are just general problems with data quality.
In this number, this really puts a spotlight on that data quality challenge. In 2018, about half of all deaths in the entire country were not certified by a medical professional. Think about that. For half the people who died, the official cause of death is, at best, an educated guess. This is exactly why that verbal autopsy initiative is so incredibly important.
And if you want to know the root cause of a lot of these data problems, this quote from the researchers just hits the nail on the head. The lack of a single, connected, national electronic medical record system means data is scattered everywhere. Public and private hospitals can't talk to each other easily, which makes piecing together a complete picture of the nation's health an incredibly difficult puzzle.
Now, these challenges, they're not unique to Malaysia. Not at all. They really point to a much bigger evolution that's happening in public health everywhere. So for our final section, let's zoom out and look at the future of health tracking.
And you can't talk about the future without talking about COVID-19. The pandemic threw a massive wrench into the works. It shut down surveys. It pulled staff away from this kind of work to focus on the pandemic. And it just made people wary of participating in face-to-face data collection. It really showed just how fragile some of our traditional methods are.
But that massive disruption wasn't just a setback. It was a real catalyst for change. It forced a major rethink. To build systems that are more resilient, more timely, and that can handle future shocks, public health experts are now looking way beyond the old 4-year survey model. They're exploring brand new frontiers for data.
And this is where it starts to get really exciting. The future could involve using big data and AI to spot health trends in real time, not 4 years after the fact. It means using data from your smartwatch to understand activity levels not from a sample of a few thousand, but from millions of people, almost instantly. It even includes things like mining social media to get a raw, unfiltered look at how people feel and act when it comes to their health.
But this brings us to the ultimate question for the future of public health, doesn't it? We have all these incredibly powerful new tools that could totally revolutionize how we track and prevent disease. But all of this new data comes with a profound responsibility. So the question we have to leave on is this: how do we harness all of this power for the public good, while at the same time fiercely protecting every single person's fundamental right to privacy? That, right there, is the tightrope we're all going to have to walk.